Yeah.
That's so weird.
Thank you for joining us today. We've got a crew here in person too. I'm really excited. So welcome. Today we are kicking off our hot topics in mixed methods research as part of our Accords Education Program seminar series. So as we get started, I'm Sarah Brewer. I'm the director of our education program at Accords. And most of you here in the room are familiar with Accords, but for those of you who are online and maybe are less familiar, a little bit about us. Accords is our one-stop shop for health services and pragmatic research on the CU Institute's campus. We conduct pragmatic research in real-world settings to improve healthcare and outcomes. We provide a multidisciplinary collaborative research environment to catalyze innovative and impactful research, strong methodological cores and programs. This particular series is partnered with our qualitative and mixed methods core. We provide consultations and team building for grant proposals and research projects, mentorship training and support for junior faculty, and extensive educational offerings like this one. Make sure everybody can see our upcoming, and scroll. A little bit of technical, Ryan. Those of you online, and I think everybody, there we go. Just want to share some of our upcoming educational opportunities before we get started. So in about 2 weeks, as part of our health equity methods and challenges series, we have Danielle Varda coming. On the 25th of January, we have our community engagement forum, and we'll be focused on sustainability as part of the series. On February 1st, the next in this series, we'll have Jeffrey Robinson here from Portland State University talking about conversation analysis. And then save the date for CopperCon, June 5th and 6th. So mark your calendars for some of these upcoming events. Before I introduce our speaker today, just a couple sort of housekeeping and how we do stuff. If you have questions, comments along the way, please put them in the chat if you are online. Make a note of them. We'll have Q&A at the end of our talk today. Moderate that, but those. And then make sure at the end you complete our evaluation. It helps us to know how we're doing, providing relevant education opportunities for everyone. If you're here in the room, those are sitting back on the back table, and I'm sure Jordan will also poke people about completing those. And if you're online, you'll get that link in the chat and as you log out of the webinar. All right. Today, I am really pleased to introduce to you Danielle Varda, and she is associate professor at the University of Colorado Denver School of Public Affairs with a secondary appointment in the School of Public Health in the Department of Health Systems Management and Policy. She also has a courtesy associate professor appointment in the School of Information Sciences at the University of Colorado Boulder. She's co-director of the Center on Network Science, director of the nonprofit concentration in the MPA program, and an advisor for the dual MPA-MPH degree program. Dr. Varda directs the Network Leadership Training Academy, which is held annually in Denver at the School of Public Affairs, and she's the CEO of Visible Network Labs, a data science startup company that's built the first social connectedness platform that supports the health and well-being of communities and the people who live in them. So join me in welcoming Dr. Varda. Welcome.
We switched over.
So Sarah didn't mention two things. I'm also a Jefferson County School Board Director, and I mentioned that because it's a lens with which I now see the world, but also the mother of 3 spirited girls, which is my hardest job. So everyone leaves it out of my description, but it's the thing that I am challenged with most every morning, getting these girls to school. Yeah, just really quick. Jordan,
I am trying to figure out how to do that.
Okay, well, thanks for having me today. I have tons of things I could present on. I'm going to go in an order and kind of see if we have time for 2 examples that I'd love to give. But the way that I like to present this kind of stuff, especially around methods, I don't present a lot of statistics and things like that, but my focus is much more on how to apply data and research and science to practice. And so you'll see the ways in which we use network science in different capacities in clinical settings and in workflows. So that's my purpose. But I like to start with the problem that my team and I are primarily working to solve. We focus on social connectedness primarily as a social determinant of health, meaning social connectedness, the way things are connected and its impact on health outcomes, mental health outcomes, well-being, both at the individual level, like how social connectedness of an individual impacts their outcomes, but then also at the systems level. So what are we doing in systems to connect the dots for people around building coordinated networks of care or services for people? I'll talk about network science as a unique lens, so we can kind of like do for a minute. And then I do have 2 examples of where we've really used a mixed methods approach to think about how to solve these problems, both using quantitative methods like network analysis and then qualitative methods, interviewing or visualization to help solve some problems. So we'll see how far we get. But this is kind of a description of the problem. We know that there's ample evidence that the quality of social connections influence health outcomes, and I'm not here to go over any of that today. So what we don't know really is how do we translate that into better care coordination and treatment. So our goal is not to say, let's provide more data that social connectedness improves outcomes or impacts outcomes, but what are we going to do about it? And the reason it's such a complex problem really is because social connectedness just looks really different for all kinds of people. So all of us in the room come here today with some kind of social support, some kind of social connectedness, but the truth is I couldn't look at any one of you and know if you have a good support system or not. It doesn't follow demographics, it's not age, disease, or where you live. It's dependent on so many different things. So I often tell this story about my own experience with adverse social connectedness. And what I mean by adverse social connectedness is sometimes people are thinking about that, they're thinking about loneliness or social isolation and its impact on an outcome. We think of adverse social connectedness a little bit more broadly. This is actually a picture of my mom and my middle daughter. And my mom had breast cancer, and when she was pretty close to the end of her life, I would always go to her oncologist with her. And I was there one time and he asked her, you know, how she was doing. And she said she was starting to have trouble getting up the stairs, fixing meals for herself, that kind of stuff. And really normally, like most of us do or hear from our providers, he asked her, do you have anyone to help you? And she said, yes, I have 3 adult daughters in town. And he was like, great. I feel like if he could have, he would have given me a thumbs up, which would have been really inappropriate. And he went on, he just went on with the rest of the visit. But what he didn't ask her was, are those people able to coordinate care for you? Do you trust them to help you when you need it? Or how dependent are you? Like the kinds of questions that really help us understand the kinds of social connectedness people have. And what he didn't know is 2 of us are estranged. One sister's husband had a recent stroke and was in the hospital. And this was even the first time like I was hearing this information. So what really ended up happening was, no
good care coordination was happening for someone who appeared to her provider to be very well connected and with good social support. So we look at adverse social connectedness across a really complex spectrum of the way people are connected to each other. So it's not just those that are isolated or alone. There's also people who are connected to a lot of others who might have adverse connections, could maybe connected to abusers or users or other kinds of people in their life. So, and this is just one of those many, many data points about how social connectedness impacts health. I'm not going to talk about cancer today. This is just one example of how it matters that our doctors or providers or social workers would know when you have someone at risk of adverse social connectedness.
Danielle,
Yeah.
I want to let everybody in the room know the table mics are on. Tech has to come turn them off. So just try to be careful around the black mics in front of you until they get here.
Actually, stuff in the mics.
Yes, exactly.
Distracting. Okay, well, and Sarah mentioned I have a company called Visible Network Labs. So I wanted to bring that up because most of the work that I'll talk about actually comes from there. I'm a professor. I used to work at the RAND Corporation. And when I came from RAND, I brought technology with me that I had built with funding from the Robert Wood Johnson Foundation. It's a tool called Partner. And over the years, kind of built that out in partnership with a lot of public health and federal agencies. And eventually ended up bringing it out of the university with a contract. If anyone has questions about how to manage IP as a person at the university, let me know. 4 years ago though, and it enabled me to start a business. So I run a company that has 24 people in it right now. And we are all, the thing I just described is what we all get out of bed in the morning to do. And our goal is to make invisible networks visible. So just everything I just talked about, like when we just believe that when you can make these things visible to the people who are trying to solve big problems, we can do better work. So, and we use this network science approach to do it. What we're really looking at are systems that involve individuals. I don't really know where to point in here, so I use my mouse. Does this work on the thing? How individuals experience systems that we are building around them, doing a lot of work and investing in, kind of what the carrying capacity looks like of those systems to absorb people's needs and help them. But we also even, this is literally a drawing that helped us get started on what we were going to do. Looking at from like a policy and federal, state level at how we're introducing legislation and finding funding to make all of those things better for people. And you can imagine this takes a very mixed methods kind of. And we have to look at this qualitatively, we have to listen to stories, but we also have to track things through data because we do a lot of measuring and a lot of benchmarking and a lot of connecting to outcomes. So I'm going to talk a little bit about that. This is the tool Partner that I built, and I'll just describe it now because I use it in all these things. So I've been a network scientist since my dissertation. I realized I wanted to measure networks. I didn't even know what that was at the time. And I've spent lots of time still learning. When I was at RAND, I wrote a grant to the Robert Wood Johnson Foundation to help public health departments measure and monitor their connectivity over time. And I knew that people in practice can't do the things that we're doing and as research R is, and they don't care about learning that. So we did a lot of qualitative work to try to figure out how people thought about these systems, what they meant when they said they trusted someone, what it meant to value a partner. And we turned all that qualitative work into a survey that we then began to test. And then with a really smart RAND graduate student, we built the first version of this tool into Excel using Visual Basic and macros. And so fast forward a whole bunch of years, we've made a lot of investments in putting it all online, and it's a tool that's used across the world now. We have a group in Ghana using it to study the school systems there. Some of you might know Dr. Jill Litt. She is using it for studying loneliness across 7 countries, but most of our users are here in the US in some kind of health or public health system way of looking at this. But we also have a version of this tool called PartnerMe. So I'm going to incorporate all this into a story in a minute. But PartnerMe is our response to realizing we didn't have a way I've been measuring systems for 8 And then I'll tell this story with one of my very favorite research partners, who I think might be on the call, Dr. Ayel Talmi, who helped develop the method and the research for developing PartnerMe. Okay, so just before I give that example, I'm going to do my professor-ish kind of thing and talk about network science for a minute from more of a theoretical lens. This slide says a new norm, the network way of working. And when I started at RAND, it said a new paradigm, because nobody was working in networks. Like, no one was talking about this, but public health was. Public health is one of the fields that has had the longest standing. Services of Public Health states it. If you want to be accredited by the FAB now, you have to demonstrate it. So it was a really great partner for us. But today, if you work in any sector, public, private, nonprofit, you're expected to work across sectors. The problem is you probably went to school for something else, and maybe I am. And so you don't really have tools for this. So our goal is to say, how can we use science and turn it into tools for people to do this network way? When I say a network, what I literally mean, when I say it, I mean nodes and lines. Some people call them partnerships or coalitions. In fact, I use nodes and lines because we measure it. So the nodes, the circles, can be more people today than ever are thinking about ecosystems. So this can be events or thoughts and ideas. So people make the nodes different things. And then the lines between them are how you measure the connection. Relationship. So if you're studying client referrals, that's what we'd be measuring it as. It could be friendship ties, advice networks. So depending on what you want to study, that's how you would clarify that. The methodology behind all of this is called social network analysis. So it collects data on who's connected to whom. Focus on patterns, and we're looking for things like the type, extent, or quality of connections. There's a microphone vibe in here that I'm trying to figure out. So, okay. Okay, and so I've talked about nodes and the lines. So just for a moment, if you look at this picture, you can imagine if I gave a survey to all these people and I said, who is your friend? And then I said, rate them on a scale of 1 to 3, not really a friend to very much a friend. So what we see here is Garth, for example, picked Bill as a friend because the arrow's pointing that way. And then let's say he gave us a 2. I'm sorry. And what we can see in return is Bill didn't pick Garth as a friend, right? So he might not think he's a friend. Or maybe they just think of friendship differently. This is why reliability of your measures matters so much and how we develop these surveys. Or you didn't answer the survey. So we learn all of that from a picture. And that's how we turn a question about who you're connected to into a visualization. This is just so my primary way of doing network analysis is primary data collection. We collect it. You can also do secondary data collection or secondary analysis where you're pulling in data on some kind of relationship between. The nice thing, what I didn't start with this and I kind of forgot what network science is really the science of how things are connected. It's really that simple. And I just came from a talk this morning that I give all the time called Thinking Like a Network Scientist, which is not the one I'm giving right now, but the big aha on that one is that you already are a network scientist because you're a human being. And all day long, you're trying to figure out connections, how things are connected or people are connected. And it's really, really hard, right? So figuring this out for other people or because it's your job requires a little bit more than your gut instinct to say, I just know how to do this. And I mentioned being an introvert or not, a lot of people think that network connections, networks, relationships have to do with that attribute of being extroverted. So I'll show you here like how we apply this lens as a science. So you can really use these kinds of data, those kinds of concepts, and come up with strategies for how to like almost build interventions for building stronger social. Okay, so here's a little bit of theory for a minute. So a basic network science principle that is really the basis of why networking is the new norm is this concept really that more is not always better. So I'll walk through this for a second. If you imagine yourself as that orange node, all of us are sitting here in this room with some kind of social connection. We call these our strong tie network, some social sub-network. These people that we're connected to are often people who we are very similar to. So they could have access to similar resources as us. They might share our values, like to go to the same events. They might look like us, but this is how people naturally form connections. Is to people who they are very similar to. It's called homophily. It's this concept like birds of a feather flock together. So that's how networks naturally form. But what's happening now and constantly is that we're connecting across all of these social subnetworks. So there was a guy in the 70s, Mark Granovetter, and he's a sociologist. And I present to community groups a lot. So I refer to researchers to like this guy. So this is a tip for working with community people. So Mark Granovetter did his dissertation work on how people get jobs. And what he hypothesized that people get jobs through their connections, which isn't very exciting. But the reason that I'm still talking about it now is because what he found was that people do get jobs through connections, but not their strong tie networks, because those people tend to know about the same jobs they do. They do tend to get jobs through these weak ties to these other networks because those people know different things than them. They have access to different resources, they have diverse thinking and that kind of stuff. So he called that the strength of weak ties. And the strength of weak ties, I think, is why everybody's crazy about networks, because they think if we connect across these social subgroups, we will have access to things we couldn't do. So innovation or resources or hard to reach populations. So that's fine. If this is how you are kind of living your life, most of us are. But as an organization and a program and folks trying to apply this in practice, it's a little too chaotic, right? So here's an alternative. There was another guy named Ron Burt. He's from school of business. And he said, Mark Granovetter, I like your ideas, but it's inefficient and ineffective. There's too many connections. What if we could connect one tie to each of those social subnetworks, maybe through a really trusted person who has, is my pointer working? Okay, never mind. So if we can connect to someone, for example, in one of those subnetworks that are maybe have access to hard to reach populations or are gatekeeper or funders or politicians, then what we can do is actually create new connections to other subnetworks and actually gain a stronger collaborative advantage with fewer connections. So this kind of thinking is like the strategy kind of thinking of more is maybe not always better. I mean, we've been raised thinking network connections, more is better. You know, popular kids had more friends, right? And so, but then you grow up and you come to realize you have, one friend who's your everything, and that's all that matters, right? So we learn this over time, but what we do in practice, let's say a funder says, we want you to form a cancer coalition, in South Denver. We often we bring everyone together that we can for as many meetings as we can. We call it counting noses. And that's kind of our strategy way forward. So building a data set, building an understanding of these connections allows you to build a network strategy. And so I always say, if there's only one thing that you leave with after a talk like this, is that you can manage your relationships to create network strategies. I even say you can manipulate your relationships, hopefully for good. And it's important that you do, but you need data to do it. And so sometimes in my other presentations, I'll go into a lot more of like what this looks like in practice, having a network strategy, but I'm going to skip to more of a kind of thinking about the method. So just a couple of takeaways on that section that you can hopefully apply almost immediately to your thinking about what you're working on. Building and managing a network, it doesn't have to be left to chance. There's actually a science that you can use and draw on. You're already a network scientist and we're using it every day. Manage your network relationships to develop strategies, but I believe you really need data to do it. That gut instinct that I'm human and I can understand other people's relationships. Or I don't have. So, and more networking is not better networking, and identifying redundancies and holes can inform your strategy. So a lot of different things that we're applying in the way that we're working with communities and practitioners around how to use data to build, stronger networks, make decisions, how they want to invest, how to keep people involved and sustain the work. Okay, I'm going to pause for a minute. I'll just see if anyone has any questions before I go. Okay, so I have two examples of using this kind of work in a real life problem. So the first one is an example of looking at systems of care for babies and young children with special health care and developmental needs. And I mentioned earlier, this work that I've done on this is almost largely in thanks to my partnership with Dr. Ayala at Talmy, who's part of this community and here at Children's Hospital. She and I were kind of matched by a friend who said, you study and do network stuff. And Ayala is a systems builder, right? So, and a systems thinker. So she was working on Wonder Babies at the time, which is, it was a partnership funded by the Colorado Trust, looking at how to improve the system of care for babies and young children. So, this is kind of a picture we have pulled from the internet of a mom who is describing what her network looked like for helping to support her kids. So what we know, and what you all probably know, and are desperately trying to figure out what these systems look like and how to have better health outcomes for their kids, but it's near impossible. So when you have a baby, a healthy baby, it's hard and confusing. And so when you have a baby with a special need, and you probably are learning that once they're born, quite complicated. So Ayala and her colleagues were working on how to build a better system of care. And so we came together and we gave a survey out to the partners of Wonder Babies. And we asked them, who are you working with? Who are these partners that you coordinate care with? And then we asked them to answer the same questions. So this is a method of, it's called a name generator method in network analysis, where you ask people to list their partners. Different than using what we call a bounded method, where you say, these are the 20 partners, how are you all connected? There's reliability issues on a name generator that you have to do a ton of, try to figure out if when someone said CDPHE, oh, now it's one node. But we work using that methodology and found this picture, what would form this picture at the end. So the center, this is a real normal structure of a network. It's called a core periphery structure. All naturally networks look like this. And it's not geographically laid out, but the center is really the Denver area, and the outside are more the rural areas. So I'm not going to actually show you a lot of findings. I'm going to tell you a story about how this data helped us learn and change and use multiple methods to try to get to the real solution, which is how do we help people navigate these systems? So Ayala and I think it's really important to take data and bring it back to the people who we collect it from and ask them if it's valuable to them. So we did that. We started kind of going around and showing people our data around the state. And people asked for certain things, like, for example, the blue nodes here are, someone asked, well, where is mental health in this network? That's what the blue nodes show. And if I never made it, and I wish I had, but if I took away the yellow nodes, you'd see very few connections between them. But I told you it's a little geographically laid out. So we also see they're kind of everywhere around the state. So this is a great talking point, because we could say, is it more important they're all connected, or is it more important they're just out there? And is more better? Do we have to have more connections? Like, what does it mean for kids and families if this is what mental health looks like within the system of care? So we were able to explore questions like that. And I had one other. We also looked at it like at the county level, and some counties were more connected and others not. But what we eventually did is we then started having a little bit of like a workshop session with folks. So this gets a little bit more into starting to do some qualitative work. So in this sense, our qualitative work was using foam board. Ask people what their ideal system of care looked like. So we have people literally build these over hours. No one ever finished. No one ever got it like completely as they wanted it. But things would happen, like that centered thumbtack would sometimes pop out and fly across the room. I teach a class called Collaborating Across Sectors, and I do this and I have to watch out, like thumbtacks fly. But it was really symbolic of what happens when you have one organization, all of kind of the pressure and ties, and they'd have to make decisions like, what do I do with that? And so they might have to reinforce those with extra rubber bands. They might decentralize it and make sure there's not just one node. So it was a really great process, but what we were able to do, and what it did for us, is it got people to really understand what we meant by systems. and these kinds of connections. Then we would take the results of this and we do this quite often. We'll take the results of something like this and we take the data that we're collecting, surveys, and we kind of paint a picture of where they are to where they want to be. And that helps us create action steps that they. That's one way that we really combine like a qualitative and quantitative approach. And it is not perfect science, right? They don't even finish their maps. And yet we do that, but we get the core concepts out. Okay, so back to this story. This is real picture. It kind of looks like clip art, but, or not clip art, but whatever it's called when you get it off the internet. I forgot. Stock image. So, but Ayala and I were one time with some parents and we said to them, look at our beautiful map system. What do you think? We were like, how can this help you as families? And we asked them to do the same thing, foam boards, thumbtacks, rubber bands. And they were kind of doing it. And one of the moms, I remember, she took the ball of rubber bands and she said, I really hate this. She was like, I don't want to be doing this work. I don't really get your pictures. She's like, the system that you're showing is like this ball of rubber bands for me. Took a minute. She said, this is my social support network. It's my friends and family and my neighbors and my doctor. I remember she put her insurance in there as a note. And she said, all I know is when I need that system, I just want an easy there, but what I consider my support. And I remember, and one other thing, they asked us, where's the family node in this network? And I think it's because of how we collected the data. We didn't prompt people to put family in, but we don't have a family node in our data set, which was like a huge realization, but really true of how we often build systems. We kind of forget sometimes to put the person-centered perspective in there. And we work really hard and we fund heavily systems building work without necessarily thinking about that. So what Ayala and I did is we asked, I remember even during that meeting, we asked people to get out pieces of paper and start drawing pictures of what their social. So again, here we go, like falling back on some kind of like qualitative method, but it was really life-changing. This is a slide courtesy of Deborah, Paul, and Ayala told me, so it's not mine, but of a family, of a mother with twins with special healthcare needs drawing her network. And what you'll see in the square is what she considered like her strong tie network, what I was talking about. If you read that, they're all like informal supports. Church, extended family. And then in the squares around is that system of care that we spend a lot of money building. And Ayala and I had been studying all this time. So what we started to do was ask lots of people to draw these pictures. And then we did a survey. And we went back to our quantitative methods using a survey to ask families to describe their networks. So we kind of did the same methodologies we did at the systems level. You'll see here, there's something we had to do to transform the data to make it look like apples to apples, and it's really not. I can go into that a different time, but what we noticed right away was how different it looks when you and when you ask the system. One's full of acronyms. The other one has things like school and immediate family and friends. And so what we started to realize right away was the perception of how people see their system. And yet we're kind of only investing in one side of this at the moment. So what we did with that information, we tried to look for patterns like across disease or zip code and how do people's social support networks look? And we can't find any patterns. So what we do find is that what is a pattern, families always talk about having a preference for tapping into their informal supports first and then using formal supports when they can't. And that people talk a lot about wanting to help themselves, being resilient, having, their own. And this, if I asked you to describe your network, probably say the same thing. This is like, of course, right? But we don't treat people this way. We don't ask them what assets they bring to their own care. So well, hold on, this should have been like a little bit of a buildup, but I'm going to talk through it. We changed our question. We started, instead of saying, we started asking like, why don't we expect people, maybe I did it. there it is. Why don't we expect people to fit? Why do we expect them to fit into these systems? And why don't we expect the system to fit around a person? And then we said, well, if it's really coordinated, then shouldn't families be telling us it's coordinated? And we kind of stepped back and said, what if our outcome of a high functioning system was how well these organizations all work together, but rather when 100% of families say it's working for them, then we'll know that system is working. And the hard part about that is that I also said there's no way to look at a person and know what their heart looks like. I described my mom's network. No one would have guessed, that was her situation. So what do we do with that? How do we build adaptive systems when it's like this unknown variable? So we said, well, first thing, we want to build adaptive systems, but before we can do that, we have to have a way that I could look at someone and understand their social support network. So I used to end talks there all of the time and take all this information and then say, one day I was going to build a tool that let a provider assess a person's personal support network and then integrate into their care. So that's what we've done. I got invited into something called the Innovator Society with the Community First and spent months working on this pitch, and we won $65,000, which seems like nothing, but we built a whole app out of it and built PartnerMe. Okay, so I'm going to talk about PartnerMe really quick. Maybe I'll have time to show you how we've applied it in one way, but PartnerMe is a real person-centered tool. So again, built on this technology platform that I built way back when I was at Rand, and now I'm at Visible Network Labs, like doing this work. We'd been building it for a long time, thinking about it, trying to figure out what questions to put into it, thinking about things like workflow, like, do you have 2 minutes with a person? Do you have 30 seconds? Or you may be like in a home visit where you're going to be with them. So what is this? We launched our first real pilot of it during COVID. We got it all ready to launch in March of 2020. And it was in an integrated pediatric care clinic. So it was like the hardest situation we could ever put ourselves in, to try to put a new technology that you have to touch into a workflow. So that was hard, but we spent a lot of time. Immediately, we realized that we had to use it as a telemedicine type tool. We didn't have to just use it in an office, but that's how it was designed. We became HIPAA compliant, which took about 8 months just to actually get, especially the technology to match that. And it's been used in a lot of places. Rocky Mountain Prevention Health Center is using it to look at early childhood networks in Southern Colorado. We have it in a primary care clinic in Westminster, mental health centers across the area. Actually, in November of 2020, I won the Prime Health Innovation Challenge with this tool, which got us into a lot of other places. But let me show you how it works real quick. So again, going back to like a screener, this is something that you could use with someone in real time. These are just really generic questions. They'll put like the PHQ-9 or the GAD-7. There are other child or developmental screeners in there. It's really flexible. So this one just says like, rate your own health. How often do you feel lonely? A separate question will say, how often do you feel isolated? A lot of people feel isolated even though they're not lonely. Then we'll ask, like, who do you rely on when you have problems? So people will list it, and it'll draw a little map like this. And then with their finger or mouse, we'll ask them a question like, who could help you if you were, for kids, we might ask something more simple, like who knows each other? But then we'll say, to what degree do you trust this person to help you, and what degree do you depend on them? And then we typically are asking some form of an SDOH question. Everyone has their own, and it's different for kids or veterans. But let's say someone gets asked and they list these 4 things in today's workflow. 4 things: childcare, food, transportation, and work. What usually happens is they get referred to 4 resources. What happens is we have a big problem, is that people are not following through when this is happening. So we're finally asking people these kinds of questions in their healthcare, but we're not very successful at following them through. So what we've done, we've taken our network science lens. So we take the answers to all those questions, and we make a new picture for them. And we say, these are the people you said help you. These are the things you say you need. And we ask them, who helps you with the things that you need? That helps us find their most pressing need with the. So And what this is all based on is that research. Like people told us they want to help themselves. So we take a real strengths-based approach. This is not rocket science. It's like so easy, but no one does it. So we take a really strengths-based approach and we say, like I might say, Sarah, looks like you're doing a really good job finding childcare and food for yourself, but nobody's helping you with work. So let's start there. So we always try to encourage the provider to emphasize what they do, what assets they've brought and how well they're doing. And then still though, try to connect them to a system. And what we're finding and testing is that we think this increases trust between the provider and the patient because that, we believe that they want to help themselves. And it's also increasing follow through because getting 4 referrals, I don't know if you all have ever been in a situation where you're getting referrals, it's so overwhelming. Getting 1 at a time with a goal, and then this can be used over time. So we can come back and see if it's still good. People who are kind of in crisis, this kind of stuff changes all the time. Other people, it might stay very stable. Some people have no help at all and some have a bunch, and literally you can't really look at a person and know. So this is really nice. It gives new voice for ways to talk about these kinds of things. So what we do with that is we create what we call social care plans. So as soon as they're all done, they hit done and a plan comes up right away. The patient can see a different view from the provider. And this shows things like, what kinds of connections do they have? Are they high trust, low dependency? One of the measures of we wrote an algorithm for adverse social connectedness, connected to a lot of others that you are highly dependent on, but don't trust. So that would put someone at risk. And we measure those kinds of things like trust and dependency. We use the GAD. GLA 3 or 9 loneliness scale. We wrote a social connectedness one. So people measure all kinds of different things in here and then they kind of track it with people over time. It does connect people to resources. Whatever resource database people want to use, it gets put in here and you can customize it with this little pencil thing on there so that you can just kind of zero in on a location. But this comes back to a little bit of like taking a network science, turning it into an interaction with the patient. So there's notes you can put in, you can develop goals. You can do motivational interviews. So it's tracking and benchmarking a really hard to measure concept that people can't usually do. Like my therapist has like a clipboard and she still uses it. Right on that. And I'm always like, you should really use my tool because you could track me a lot better. So it's the kind of thing. So a lot of people who use it will be like, I always ask these questions, but they don't have a way to capture it. And they don't have a way to look at it at the like organizational level. So what does our population look like? And so just to end what we do is like, so this is like that image of each individual, but to go back to that work that Ayala and I were doing, we do want to look at those people embedded in the larger system. So we can look at the data, and some people use both of our tools, PartnerMe and the system, and they put it all together, and that way we can see like where people are within, and we can start to understand where informal and formal networks play a role and things like that. And we provide a lot of analytics. I know this is a mixed methods talk. I keep having to check myself because I do a lot of primary data collection through surveys, but none of this would be possible if we weren't like just using a visualization to understand the data is like this very qualitative way to capture not only what people are self-reporting they need, but saying back to them, this is what I heard you say you need. Is that correct? And so it's really a great way to get people really involved. So this is just an example of the social care plan, but this is actually a different daughter of mine. She's now 13 and this tall, but she's presenting with me because when we first started creating this, I'd bring it home and the girls, so they like to play with it, but and so I'd always give it to them. She was using it one time to and asked me, can I answer the questions? She was answering like those SDOH questions, so she'd always pick like child concern. Childcare. We started modifying it for kids. And so you can't really see probably is the options there aren't like normal SDOH options. They say things like, it'll say like, what are you struggling with? And it'll say like being bullied, being hungry, getting enough sleep, doing homework. And then we ask them to answer some of the same questions. And what's remarkable is how much they like lean into this. Kids just love this. And so you can ask them all these questions and they will not answer you, but you can give them a technology and they will expose their souls, onto it. So it's I think technology is a really important way to address mental health and hard to measure problems. And it's fun and it feels very much like a tool it's like a game for them. Okay, so I'll just end with this, not that. There's a little bit, this is not what it was, but considerations that I've had to present before about like how this is hard in the workflow. There's questions we get asked, like who will see the data and when. Providers always want to shut off the patient access to seeing their data until they get to meet with them. And then they will say, we'll turn it back on. That was a learning for us. The capacity to understand what you're looking at is really hard. That's probably our biggest challenge in adoption. I always wish I could come to like medical school on this so that providers would think about this before they ever get out into the field. So when they get tools like this, they can use them. And some successes and challenges. But the last thing, I'm going to do this really quick because I want to save time for any conversation, but I wanted to mention this has expanded to a lot of different things, but we have funding from the NEKC Foundation just to use PartnerMe to study adolescent youth social connectedness. But when they funded us, they said, you actually have to hire youth to work. So we ended up hiring, this is our program officer, there were actually 4 fellows, these young people who we literally had to pay them and not had to, we loved paying them. They were on our research team, they collected data with us and they present. Kyra right there has presented with me several times. But I wanted to bring it up because this is a really great example of ways in which we apply this. We did this project where with learning, despite everything I feel like I know about this, I was like, I don't know enough, right? So if AKC wants us to modify PartnerMe for adolescents, we need to study it first, right? So we did this very exciting mixed method study where we did interviews just to develop some ideas around what we would measure, what's important to kids. Then we used all the findings from that to modify the survey, the questions in PartnerMe. And we gave that out to them. And then we did a whole bunch of focus groups at the end. And these young people did all of this work with us. And I only brought 2 quick points here. There's like tons of work that we've done on this and lots of reporting, but we would find these like really interesting things. Like when we asked where folks reported receiving more help, white youth would often report more help with things like depression than our youth of color. And this was so interesting that when people talked about social connectedness, the ways in which they said, this is something I need, or I get help with, varied across race and some age difference. The youth of color, almost over a third of them indicated that there were no areas here that they needed help with. And the reason I bring these up is this, we were like, what are we looking at? Like, what is this? Why is this so different? And these are reflections from Kyra. So when she presents with me, she'll talk through all of these, and I'm not going to, but she talks a lot about how, for example, in social connectedness for young people, they're encouraged not to ask for help. Talking about depression is something that doesn't happen. So kids, our white kids, were more like used to talking about depression and how this was. So just these little nuances, and I won't do this because this was definitely her voice, but the reason I bring this up is because it was these little nuances in some of our data collection around like letting go of quantitative data and saying, let's just ask people that we've learned some of our most important back into things. I won't bring it up here, but there's the youth asked us, instead of listing a multiple choice question that said like, how do you identify by race or ethnicity? They asked us, can you just, can we do it open-ended? And so it's in a report, I won't have it here, but when we ask them that, we have a little word cloud, the ways that they describe themselves. We're across race, ethnicity, but also like religion or family, family type, home type, and things like that. Super fascinating to ask people questions that we, I've turned it into surveys forever and I still learn tons. All right, so I'm gonna stop and hopefully leave some time for some.
Thank you so much, Danielle. I'll start with, are there questions in the room?
That was so fascinating. Academician group. What are you missing? Because you don't.
Well, I'll give you some language for the question you just asked. A strategy around building it. Literally called as network intervention. So I like to say it because it helps us like understand what we're doing when we're trying to build strengthen networks. So the only thing that comes to mind really quickly is really that example of when Ayala and I were like, we have a plan. We're coming here with thumb wars and thumbtacks, right? And this is what you're going to do. And even then we were like, people like this, people like building these boards, and realizing or sensing that there wasn't something that they were like. It's not even that they were like, I'm not into this. They were like, I am feeling like negative. And instead of us trying to talk them into why they needed to do this because we needed to know this, I just think I do a ton of community-based work, and there's so much about you letting and acknowledging that the expertise in the room totally different but essential to the work. Often I might say to people when I'm working with communities, I acknowledge that I think I'm good at something. I might say I'm a network scientist and that's my expertise, but I'm only half of our team. And I'll say, you guys are the other half and you're important and we need you. So doing a talk for RWJF soon on this topic. And one of the things I think is essential is making sure what we did with the fellows, don't ask them as like an advisory group. That people don't like to come to the table and be asked their opinion, especially if it's about a lived experience, and then to leave the room. Let them like have a weekly meeting with them. It feels very untraditional. I am very untraditional in my ways, but I think it's really important to know that even they have that context that we'll never understand.
I have a question online, and I think this may be, but I'll see what you think. So the question is about the friendship paradox, and there's a couple pieces. So first is, have you used it as a sample? Talk about that. And then they also asked a little bit about how you might use that friendship paradox to evidence-based practice. Okay.
Yeah. So I think that's essential to the question. Does anyone else know?
Well, and that's why I said it might be tangential.
Okay. I have a
so
feeling
I
it's
didn't
like
hear
a
you
theory.
use that term either. So
Okay.
Yeah.
Tell this person to email me, and I'll be Googling that on the way home.
Heather, I don't know if you heard that, but Danielle said she's happy to email about the friendship paradox. And then we have one more. Have you done any projects that calibrate social connectedness through multiple perspectives? So thinking about your patient or person-centered, family-centered, providers, and what that might reveal for underestimation of some of this. How you calibrate sort of those different perspectives around networks and social.
like, I'm in a different school, and the way people are phrasing questions is throwing me off. Honestly, I just am thinking of things that come to mind, but a real big, I've mentioned it kind of offhandedly a few times, a real big realization for me is like from the federal government, for example. When I showed you that picture of the system of care in Colorado, what that was a picture where we had collapsed a bunch of nodes into one. Those big nodes are all the big funded organizations. So one thing I think this might not answer the question, but what it makes me think is if we only come at it from that perspective, investing in an intervention at all. But when we start to calibrate, I guess, the perceptions of all the others, one of the real strengths is that approach is you might, and it's very hard for us to terminate policies. And so I think when you put all the pieces together, sometimes you have to, like Ayala and I did, we were like, wait, we actually don't know if we have a good system of care or not for the thing we've been working like 4 years on. And then coming back and saying, because I'm open to these different perceptions, I might be able to.
So much. And I know we did have a couple more questions. I'm sure that Ayala and Joanne may also reach out after the talk. And then for those of you who are online, I just want to remind you to do our evaluation, and thank you so much for attending today. Everyone. Absolutely. And I think Jordan.